Hey, everybody. I wanted to talk about utilization management. Any concerns, questions, reach out to me. You have the chat here, and you can also unmute yourself. If this is on replay, you could put it in the comments, and I'll follow up on YouTube or on Facebook. My name is Sharon McLaughlin. I am a plastic surgeon by training, also general surgery. 5 years, completed my residency there, became chief resident, and then did a fellowship in plastic surgery. I was in private practice for a good 10 years, and I started questioning, is this what I wanted to do for the rest of my life? And I knew that the answer was no. I just didn't know what to do about it because I had spent so much, it took me 15 years to get to be a plastic surgeon, right? 4 years undergrad, 4 years medical school, 5 years general surgery, 2 years plastic surgery. And it was always a straight line. Wasn't always easy, but I knew that this is what I wanted to do, and when I finally reached it, I was disappointed. I thought that there would be more. I thought it would be more fulfilling, and somehow I didn't. In retrospect, I didn't know what I was getting myself into. I think it was always the challenge of having to do more, of getting something that would be hard, of being told, no, I can't do something. And I think that propelled me all the way through. And then I finally got it, and I was like, this isn't what I want. Something's wrong here, something's off. And I didn't know what it was. I really just kept on questioning myself. And I tried to talk to my husband about it. It was hard because he didn't understand. And my sisters, they're in nursing and they didn't get it. And some of my close friends, I think, did get it. But they were set with their careers and they had understood that it was, more than they anticipated as well. But this is what we did. We just went day in and day out, and it's something we worked for, and we just kept going. But I had a feeling that all I all I remember thinking was that I knew that I had done it for at least 10 years, but I probably would not be able to do it for another 10 years. It wasn't sustainable. And in retrospect, could I have gone into another field? I think dermatology probably would have been more fit. I like the procedures. I like office space compared to hospital. Very hard to get into, right? So I'm not even sure that was ever an option because I didn't even apply for it. Um, I'm not sure what the answer is. Maybe being with the team, rather than trying to do this on my own. Initially, I was with somebody, but he was, older in his career, along in his career, and he didn't want to do call anymore. So the calls, stayed with me. I was pretty much on for the practice 24/7, and that got tired. After the loans were paid off, I knew that I wanted a better lifestyle, so I went out on my own thinking it would be a better lifestyle, but it was definitely tough as well. Had to deal with all the emergencies, and you could say, well, there's not that much in plastic surgery, but I was doing emergency room call as well, and then even my own patients, things came up, they were concerned. I was certainly concerned. So I felt like I was always on, and really, in reality, I was always on, right? So I remember being asked by a chief medical officer to do some quality assurance reviews, chart reviews, and I could be honest with you, I did not want to do that at all. I felt like at that point in time, I had so much on my plate, and to add anything extra would just be too much for me. But I did say yes to that because he's the chief medical officer and a very nice man, and I didn't want to say no, so I started doing it. And I actually enjoyed the work because I was seeing things that were different than outside of plastic surgery. It reminded me of the days of being in medical school where we were always learning something new and it was fresh. And I found some interest there. That's all I can say. And I actually started a consulting business doing independent physician reviews. So if you're thinking about utilization management, you may want to look like Google independent physician review and see what comes up. You can apply for some of those jobs, especially if you're a specialist. They look for the specialist. But internal medicine, family practice, just try it. You never know what you're going to come across. So just try it. So I ended up starting a consultant business. And because I was a plastic surgeon, there weren't that many surgeons doing it at the time. There still isn't, but well, more. I shouldn't say that. More now than ever, but that's the way medicine is going. But this was back in like the early around 2011. I started this, and it grew fairly quickly. I made a name for myself. Again, it wasn't very, there weren't a lot of people doing it, so a lot of surgeons anyway. So that was good. It was pretty open for me. And the only thing that I could think of why I didn't stay with it is because it was like 1 month really good, next month not as much. And I had anxiety, and I dealt with this in my own private practice as well, which definitely added to my stress. Some months were like really good, off the charts, and other months not so much. And I didn't like that up and down. And I was like, okay, what else can I do? So someone had suggested utilization management, that doctors make money, this is how they make their this is their lifestyle, they work for an insurance company. So I stepped into that. They didn't pay very well at all, but I knew I needed experience outside of independent review, so I did that. And then an opportunity came along with a very large company that we all know the name of, and they offered me a full-time as a plastic surgeon. And I thought about it in retrospect. Maybe I should have done it. At the time, I didn't want to give up my practice. I didn't want to do this full time. I just knew that I was not ready to make that shift yet. And then a couple more years went by, and this opportunity opened up for the company that I'm with now, and I took it. At that, a couple years later, time had gone by. I felt differently, and I took the opportunity. So that's how I got into utilization management. Um, Did I was I like stepping out of the pot into the kettle? I don't think so, because I made the transitions in my mind very slowly. I had thought about leaving medicine for a while, like literally years before I actually did it. I gave up. I joined this company in 2014, and I told you around 2009 my dad had passed away, and that's when about 10 years in, I had started thinking about, is this really what I want to do? Like, I think seeing death in front of me, to somebody who was so close to me, and I don't think I really lost somebody that close to me prior to that in my life, just had me thinking about death. Like, we're all going to die someday. And is this how I want to spend my time? I was always stressed, always on the go. And I knew the answer was no. So, fast forward, I'm with this company now for 11 years. There are many different things that you can do within utilization management. It's not just doing claim review, although the bread and butter of utilization management is doing claim review, being able to look at the criteria. Does this meet? And then using your expertise as a physician. Like, so the criteria says this, but is there something else going on in this patient, right? There's comorbidities. Usually, any of the criteria are going to address one medical condition, not multiple medical conditions. I've never have really been told that my denial rate is too high or my denial rate is too low, but there is something about consistency and also being cohesive within the group. The group, this is part of the NCQA accreditation. When the company gets accredited, part of that is looking at what testing or quizzing do they do, or how are the determinations made. And if you lined up 10, 10 medical 10 medical directors, would they all come to the same conclusion? Would 80% of them come to the same conclusion? 90%? You want 90% or better. So everybody looking at a case, whether they're internal medicine, general surgery, pediatrics, they would come to the same conclusion, the same rationale, the same determination that's made on a case. So we spend a lot of time doing meetings, making sure that we're all aligned. Um, so we do claim review, but we do other things, as you can imagine, a health insurance company. And you could do this on the hospital side as well. The hospital side, again, I can speak to utilization from the hospital advisor, uh, a physician advisor position. But from a health plan point of view, I can certainly speak to it. There's different committees that people get involved in. Again, you as a physician, you may be dealing with like population health, you may be dealing with mental health, you may be dealing with some policies that have to be created or guidelines that have to be followed, such as if you think about like the United States Task Force, we want to make sure that when they come out with a new recommendation, that we're following that. My background is also in coding and billing. I took some extra classes. That was through AAPC, but AHIMA, they also offer classes. So you can get some coding and billing. Do I think you need it? No. But I think that if you go into this blindly, that you could be in trouble. If you are looking at a claim or how, well, like a procedure, but you're not actually looking at the codes, like they could be saying, I want to do heart surgery, for example, I want to do a valve replacement. But then if you look at the codes that they're actually requesting, it could be a valve replacement, but it could be other things as well. And so sometimes they ask for too much, things that are bundled within other procedures. We do have systems, most of the health plans have it. They're called CCI edits that you can't bill two things together because one is inclusive of the other. So that would be part of payment integrity, like getting involved and asking physicians, we see this, but does this make sense? And or we have a physician who's complaining about this or that. They think that they should be billed for this procedure. What do you think about that? Reading. My background is in surgery, so for reading operative reports, procedure reports. Uh, there's a uh, opportunities to get involved in volunteering. So you can see that there's different. When I say volunteering, like it could be like food banks. It could be uh, the company as a whole. We work with Medicaid patients, underserved, underprivileged. So we want to make sure that we're doing the best for our members. And one of the ways that we do that is by getting out in the community. So we do a lot of community events, fundraisers as well, where the physicians, take part in that. We also represent the company, and again, each company is different, but by and large, for a whole, this is how most companies operate. So the one of the things that I would tell you is that if you think that you don't have experience, you probably do. I feel this over and over again with women physicians. We all come to the table with our own experience and we all have experience, but we seem to undermine our own selves. Like we seem to question it and have a lot of self doubt. So that's one of the things that I would say, like start writing down your skills. Again, you're going to think that you don't have any. Talk to different people, whether it's in utilization management or something else. If you truly feel like, this isn't for you, you want to do something different, what else can I do as far as being a physician? Talk to people. They'll let you know. That was my path into utilization management, but there are like everyone has their own path to get into it. I can tell you the coding and billing has helped me tremendously. Um, I get pulled into a lot of different meetings, a lot of different emails, like people questioning things. They want some background, so that helps with job stability. There are some companies that you do a medical, you give a medical chart, and they say, okay, this is what they bill. Does this make sense? So you could look into those companies that do a lot of billing and coding. There's a lot of companies that do work on not a lot, but some that work on DRG, which is the inpatient side. So you could look at that. I have talked to people over the years as far as jobs in that area. I myself like payment integrity, what we were talking about before, making sure that things are being billed correctly and also paid out correctly. Sometimes there's errors in our system, like any company or any system. There's errors there, like the machine itself or the software could only do as good as what is put into it. So if it's not put in correctly or there's an edit that's not firing, that could be a problem. um, Also, like we mentioned payment disputes. We're working some with the IDRs right now. What else? I mentioned population health, preventative care, different populations, like medically fragile children. There's a team that works on that. There's a team that works on in special investigations unit. There's a team that works with care management. So a lot of different areas that you can get involved in. Policy making, there's a committee of that. There's a committee for different lines of business, such as Medicare. The rules are very strict with Medicare. So we have a team that works strictly with Medicare. So I was going to say it's endless, but it's not truly endless. But there are not a lot of different opportunities that you can take and that you could do with it, rather than just in addition to claim review. I am in management. I can tell you before moving into senior management, it was mostly claim review for me. Like I did a lot of claim reviews. So let me talk to you about that. About 40 cases a day. There's a clinician that reviews the cases ahead of time. They'll send you the chart. You have access to the chart. You have access to the criteria. You have access to the summary notes by the clinician. And we go through those cases on a day to day basis. If someone disputes it, they have a peer or right to a peer to peer, or they can send in additional written information. And then they also have the option of appeal. So you can see where the medical directors are involved in each of those layers there, the initial, the reconsideration, and then the appeal level as well. So we get involved in that. That's pretty much the bread and butter of it if you're not in management. And then there's opportunities to be involved in other things. Most of the work is claim review at our company, but there are opportunities to get out and to learn if you want to learn. Again, it's a whole health plan. So if you wanted to get involved in data analytics, if you wanted to get involved in the finance area, recently we had a leadership, my company is national. We had a leadership meeting and I met a physician who works in finance. She wasn't presented as Dr. So and so. I just met her by her first name. And ends up that she's in finance. She's not doing the medical side of it. She's in finance. She said that she was an emergency room doctor and that she went back to school for accounting, and one thing led to the next, and now she's on the finance side of it, which is interesting, right? So I just want to. There's different avenues to do to get into insurance work. And then there's many different areas within utilization management as well. You could be on the hospital side, you could be on the insurance side. Also, with like different opportunities, there's a lot of network. There's time. We meet with physicians, some of the physician groups. There's value based care that's big right now, or has been big, and trying to move in that direction. So different opportunities. So as far as like a, a regular day, it's about 8:30 till 5 Eastern. For me, it's Eastern Standard Time. We do some calls sometimes, depending on the company. All companies are different, but for us, it's about working 5 to 6, about twice a year for 1 week. And then we do weekend call, which again is about twice a year given the size of our company. And we do that up until about noonish. We're done usually by noon. So not definitely as rigorous as it was for in private practice. So I talked about that time balance, that work balance. It's definitely easier for me now than it was in private practice. So there's going to be pros: remote position, better hours, like as far as work life balance. But the cons: can you sit in front of the computer day in and day out? Because that's what the job entails. If you like to physically see people, I can go into the office, but me from Long Island into where the company is, it could be a 2-hour commute. So there's we talk on the phone. We do a lot of I was going to say Zoom, but we've moved on to Google, like Teams. So we did a lot of Teams meetings, um, and there is opportunity, even messaging people back and forth, that you still feel a connection with. So that's important. If you need to physically see people, depending on the health plan or in the hospital as well, a lot of these positions are remote. So it could either be a pro or con, where it'd be full with that. And then there's let me see what else I have. I have like, do I think that utilization management is important? I do. I see a fair amount of fraud, although I'm biased because I'm seeing the small percentage of it, but it's right there in front of my face, and it's what I think about, when I just about all the cases and stuff that I review. And there are, unfortunately, pill mills still. They just are, even with all the crackdowns and all. Unfortunately, they still exist. They, provider groups, physician groups, come, they open up. There's probably not even a physician involved, but they get a hold of Medicaid numbers, or health insurance numbers, and they bill them, and they bill them for services not even provided. So for the Special Investigations Unit, I think it's important to have utilization management. I also think it's important as far as care for the patient. or a member, in the sense that is this proven? Is this procedure that's being requested, or is this service being requested, has it been proven? Is it safe? Sometimes we pick up things because either something fell through the cracks, or one doctor didn't perhaps talk to another doctor. So us getting the medical records, we're able to see things. So I do think there's definitely a safety component to it as well. Could we be obstructionist? Yes, and I think we're working for that, or on that, I should say, in the sense that codes, like everything has to do with codes, like these codes, if a high percentage of them are being approved, there's no sense in continue to review them, because it's just slowing down more paperwork for you, more paperwork for us, and a delay for the member getting their care. So we realize that, and definitely strides are make or progress being made in that area. As far as the life I spoke about, 8:30 till 5, a lot of case reviews. If you have an entry level, or you're not in management, and some of the medical directors, they're okay. They didn't want to move into management. Management is, you're not doing case reviews as much, or if any, but you have to be available to the medical directors for questions. You have to be available to senior management for questions. You have to be available for different meetings. There's multiple meetings, much more than before I took this position. So it's up to you, like where you want to go. As far as leadership, there's opportunities always, no matter where you are in your career, to have an opportunity to be a leader. Um, Maybe it's taking stretch assignments, maybe taking a lead on something that interests you. I think the passion has got to be there, but also eyes have got to be on it, right? There's no sense in doing a passion project if no one's going to know about it, or it's not very important to the company as a whole. So be very careful about where you spend your time. Does it have eyes on it? Is it going to help you with leadership? And is it something you're passionate about? Like, it has to fulfill you somehow, right? You have to get some benefit out of it. Um, so, your experience as a physician, my background is in surgery, others could be in internal medicine. We have some behavioral health, we have pediatrics, and we have specialists as well. So, everyone brings something to the table, and I'm sure that you have something to bring to the table as well. You could start off doing, some assurance, quality assurance. If you've been on peer to peers, you have some experience already with utilization management and how this works, being familiar with different criteria, taking the opportunity to talk to people. As I mentioned, there's always people out there, and you can get a pretty good grasp just by questioning people, messaging them. A little information at a time really can build up over time as well. So just make sure you're getting out there. As far as a career trajectory, um, if you think about whether it's at the hospital level, or at the health insurance plan level, or facilities, group homes, most of the people in management are not necessarily medical background, right? We know that. So does it help to have a business background? I believe it does. If not for anything, at least on paper, because people do look at it. So I made sure that I got my MBA. I strongly suggest you look into a master's. For the longest time, I wasn't ready to move up. It was work balance. I wanted to take care of my daughter. I wanted to spend more time with my daughter. And now that she's older, I feel like there's seasons of change, and that it was a good opportunity to move up, to take this opportunity. Um, but so I made sure that I had my master's. But there's masters in leadership. There's masters in science. Like, take a look around. Like, what a population, public health, data analysis. Like, what do you want to? What are you interested in? So, um, consider additional schooling. Consider billing and coding if you want to do that. That can help. Independent reviews, independent physician reviews, maybe working per diem for a company if there's any opportunities to work per diem. I have a friend that works up to 20 hours, I believe. It's up to 20 hours a week, I know that. And she can pretty much make her own hours. She tells them ahead of time, when she's going to work. There's other companies that I mentioned, like they're just checking a chart to see if the codes are correct. Um, with my company, and a lot of the companies, there's a compliance, like you have to be done by 5 o'clock, the cases that you're getting, so they have to be turned around. So it really is like right up to the end of the day, it's like go, go, go. Like you have to make sure that not nothing is out of compliance because that could help hurt the hospital, hurt the as far as payment, hurt the insurance company as well as far as regulations, state regulations. And then we have the pathway to transition. Each pathway is going to be different depending on what your interests are, what you're exposed to, what you put yourself, like what you reach out to, different things that you want to do, and it really is exposure. Like, how do I say this? It's experience, right? It may be totally foreign to you right now, but given time, a little bit at a time, it makes a world of a difference. My daughter was doing a medical terminology course, and if she's having a hard time is the bottom line, and it's just at the very beginning, like it's the beginning of the book for her. But I said, like over time it all comes together. It's a little bit at a time, um, and then you really do build up that knowledge base. And the same with utilization management, the same with anything that you're interested in that you just don't know, have an idea. It's a matter of getting out there, talking to people, and just finding out more about it. And then, it always comes down to who you're working for, right? If you decide to work for a company, finding out more about them, because it comes down to management, like who is your direct manager, who is the team that you're working with. And these are all important things, right? So keep that in mind. If you guys have any questions as far as utilization management, reach out to me. I've told you before, put it in the comments. Again, my name is Sharon McLaughlin. I am the founder of Female Physician Entrepreneurs Group. Join our Facebook group, get on our mailing list. We have events like this about once a month. We also have guest speakers as well. So make sure you're part of it. Our group is pretty active. You'll hear a lot of different things, like talk like this. And so join us. All right, guys, nice to see you, and I'll look forward to hearing from you. Bye bye.